I think there's a lot of people who are not getting tested, um, and that's not a good thing. And there could be a lot of reasons for that. That people don't want to know that they have COVID if they get sick. But you need to get tested so we can do the contact tracing, because quarantine and isolation are two of our best tools yet. And we have to get people tested who are sick. And that includes if you've been vaccinated, because if we've been hearing about breakthrough infections, they do occur in vaccinated people, and you still need to be tested. That way we know what you know what to do in your household and with your workplace, and while you have your cold symptoms from COVID, you still need to make sure you don't give it to others. It still largely is two different things. We have a pandemic, which is an epidemic in our unvaccinated people, and it's all Delta variant now. And then we have sort of more of an endemic upper respiratory tract infection occurring in vaccinated people, at least those who are not immunocompromised. I took a little bit of heat for calling it a COVID cold, but really that's what it is. It still is a COVID cold, because a cold is an upper respiratory tract infection that affects the back of your nose, your nasopharynx, and might give you a little bit of cough. Cold doesn't give you pneumonia. Cold doesn't give you systemic problems with other organs in your body. A cold doesn't land you in the hospital. So I'm going to stand by calling it a COVID cold. Yes, some colds are bad colds, and some colds are not so bad. And that's kind of what's going on. I think the one symptom that comes with the COVID cold and breakthrough infections that bother the people the most is the loss of sense and smell. We're starting to get some information about that in people who are getting breakthroughs, that doesn't last nearly as long as it does in people who are unvaccinated. Also, I've heard that some people feel fatigue afterwards. And yes, that happens. But we're starting to get some information now that long COVID, which is long-term symptoms after COVID, is pretty unusual in people who have breakthrough infections. So that's good news. So I'm going to stand by. I'm going to still call it a COVID cold. What's the important thing about a COVID cold is not to give it to somebody who has special needs. In other words, who's immunocompromised or unvaccinated, or at the extremes of age, or has a lot of underlying medical problems. That's the transmission from a vaccinated person that we worry about, is vaccinated to unvaccinated. Vaccinated to vaccinated transmission from breakthrough infections occurs a lot less frequency than it does between unvaccinated. Where we're mostly seeing it is in households and or people who spend a lot of time together. So for instance, you decide to drive down to Atlanta together, 5.5 hours together in a car. One person has a COVID cold. The other person's also vaccinated. And that's a transmission that could happen. It's like colds. Colds can get transmitted between people who are immune to that type of cold.